Welcome. It's my extreme pleasure to serve as a moderator for today's Ask an MS Expert webinar. I'm John Strum, and I'm the host of the Real Talk MS podcast. Each week, Real Talk MS reaches thousands of people in more than 90 countries around the world with the news that people affected by MS need to know. I'm also a non-scientist member of the International Progressive MS Alliance's Scientific Steering Committee, where I work to ensure that the perspectives and priorities of families affected by progressive MS are represented in all of the work undertaken by the Alliance. I'm a district activist leader for the National MS Society, and I also chair the Society's California Government Relations Advisory Committee. My wife, Jean, lived with progressive MS for 23 years, so I've had a front row seat experiencing all the ways that MS can impact a family. I'm thrilled to be with you today. People are continuing to join our webcast, so let's give them another few seconds and then we'll get started. Thank you to all of you who are joining us today on GoToWebinar, Facebook Live, and YouTube Live. Due to the large number of participants joining us on GoToWebinar, everyone has been placed in listen-only mode. Today's Ask an MS Expert webinar is one of a series of virtual opportunities the Society is committed to offering, so I hope you plan on joining us each week. Our objective in all of our Ask an MS Expert programs is to connect with you, share important information that you can rely on, and provide a forum for you to connect with experts on the topics that are on your mind. So as I chat with our expert today, please feel free to post your comments and questions as they come to mind on Facebook and YouTube, or type them into the question box if you're joining us on GoToWebinar. I have a helper working behind the scenes with me today. Julie Fiol is ready and waiting to capture your questions while I'm busy talking. We'll try to answer as many of your questions as we can during the Q&A portion of today's program. And I know many of you might have some very specific questions related to your own situation. Because of our limited time together, we're going to be focusing on the questions that pertain to everyone. And following the webinar, the Society's MS Navigator team will be standing by to address those specific questions that you might have. I'll be sure to let you know how you can reach an MS Navigator before the end of today's program. If you're interested in reviewing today's conversation with our expert, this webinar is being recorded and it'll be available on the Society's website for your reference. And I have one more housekeeping detail that I want to share with you. With the 4th of July Independence Day holiday approaching, we're taking a break next Friday. We'll be back on Friday, July 10th, with our regular weekly programming. Before we dive in, I'd like to acknowledge that these are new and rapidly evolving times, so we do have a disclaimer to review. COVID-19 is a new coronavirus and limited published data is available about this virus and MS. The information and recommendations presented in this program are based upon the individual professional opinion of MS experts and the evidence currently available about MS, infections, and disease-modifying therapies. This is a rapidly evolving situation, and we'll update information as it becomes available. The information that is shared does not substitute for your healthcare provider recommendations. Please check with your healthcare provider before making any changes to your treatment plan. And be sure to check the Society's website at nationalmssociety.org/COVID-19 to keep up with the most updated information on MS and COVID-19. We've taken a few weeks off from focusing our discussion on COVID-19 and MS, but things are changing. Experts are continuing to learn about COVID-19 and its impact on people living with MS. And today, we'll shift our attention back to COVID-19 and discuss what we're learning from the COVID-19 and MS data registries, the updated guidance that's been released on MS disease-modifying therapies during the COVID-19 pandemic, what the latest is in the development of potential vaccine for the virus, and how to protect yourself and others as the number of people affected by COVID-19 continues to rise. Our expert today is Dr. Aaron Miller. Dr. Miller is the chair of the National MS Society's National Medical Advisory Committee. And he's also the the medical director of the Corinne Goldsmith Dickinson Center for Multiple Sclerosis and a professor of neurology at the Icahn School of Medicine at Mount Sinai. Dr. Miller also serves as vice chair for education in the Department of Neurology, and he's participated in numerous clinical trials of new treatments for MS. Dr. Miller, welcome and thank you for being with us today. You joined us for our very first Ask an MS Expert program back in March when we had very little understanding of how COVID-19 might impact someone living with MS. Now, thanks to a few different patient registries like the COVID-MS database, we're beginning to learn more about how people with MS have fared after contracting COVID-19. We also have updated global advice from the Multiple Sclerosis International Federation to help people living with MS in making treatment decisions during the pandemic. Dr. Miller, I'd like to get us started by asking you, what have been some of the most notable things that have happened since you last gave us an update back in March?
So, John, first of all, it's a pleasure to be with you and with all the people in our audience who are concerned about this very vexing and challenging problem. We've clearly been living through some very difficult times, and I'm here in what was the U.S. epicenter of the COVID-19 pandemic in the United States, and one of the biggest changes for me, of course, has been to see that through efforts made by the people of New York, we've been able to go from the most heavily infected area of the country to one of the least, if not the least, infected areas of the country. So that has told us that if people cooperate with the recommendations of healthcare authorities and responsible governmental officials, that we can protect people, and that's most important. What we're always trying to do is preserve the health of not only people with MS, but everybody, and of course, we're particularly interested in people with MS. So one of the big things I would say that we've learned, and this was particularly worrisome, I think, to many people with MS, is are they more susceptible to MS? And we don't have completely definitive information about this because we don't really have a sizable denominator, but the overall impression of everyone is that MS in and of itself is not increasing the likelihood that a person will be infected by the virus that causes COVID-19 disease. And so we're really focused on, is there a difference in the severity of the disease in people with MS?
Maybe we can talk a little bit about what we're learning from the COVID-MS registry. What are the number of cases that have been captured so far? And have any common factors been identified among those patients with MS who have died from COVID-19?
So we have several hundred patients now in the COVID-MS registry, and more patients are being added every day. One of the things that the National MS Society has done in conjunction with a consortium of MS centers in establishing this registry has really been to reach out to MS providers around the country to try to encourage them to enter data about people with MS who have COVID-MS or who have COVID-19 or are strongly suspected, even if not confirmed, for having the disease. But around the globe, there are other registries that are similarly collecting data. Each one is not necessarily collecting exactly the same data, but there are many commonalities in these registries. And we've seen preliminary reports from a large registry in Italy. The MS International Federation has an international database that at last count, I believe, had over 600 patients registered, and again, increasing by the day, and coming from many countries around the world. So we're putting all this data together and gradually getting a picture about how the disease-modifying therapies and other factors may impact the risks of severe COVID-19 infection.
Have there been any common factors identified among those patients with MS who have died from COVID-19? Do we know
Yeah.
a bit more about what they might have in common?
Yeah, basically, John, we've identified factors that seem to be consistent throughout one registry to another, and it really comes as no surprise because even in people without MS, the presence of older age, underlying comorbidities such as cardiovascular disease, pulmonary disease, diabetes mellitus, those are all proving to be greater risk factors. Greater disability with MS, people who have walking problems are unfortunately at risk for more severe disease. Those people tend on average also to be older, and that population also tends to have more comorbidity. So when those factors align, it really puts a person at more severe risk and just emphasizes the importance for people with MS, especially people in those categories, to take all the important precautions that we need to protect ourselves from getting infected with this coronavirus.
And we're going to get to those precautions. They are important, as you said. You've also shared that these registries are still collecting patient information, and this may be a question to which there isn't yet an answer, but I'm curious, how much more data needs to be collected so that experts like yourself can make more solid assumptions?
Well, that's a particularly difficult question for me to answer because I'm not a statistician. However, I will tell you that it varies because the use of different DMTs, disease-modifying therapies, varies. So some are very, very widely used, and we're likely to collect more data from them. Others are much less frequently used, and so it's going to take longer to collect enough numbers from them. I'd say that for some of the more frequently used disease-modifying therapies, we're getting to the point where we're having enough numbers, and there certain consistency emerging from one registry to another to start to give us a little bit of confidence about what we say with regard to these medications, which is quite different from where we were back in March when I spoke for the society. And at that point, we were making recommendations to providers and, for that matter, to patients, really based on hunches and what we thought might be the biological action of some of these respective treatments for MS. Now we're starting to get real data. And as Governor Cuomo, my governor, has been stating in his daily news briefings, which went on for 3 months till last week, he said, there's opinions and there's facts. So we're trying to get rid of the opinions and trying to get more facts.
An excellent philosophy. You recently participated in an effort organized by the MS International Federation that brought together MS specialists and advocacy organizations from around the world to review data collected from these MS and COVID-19 registries that we've been discussing, and then to be able to update the advice for people living with MS. Before we drill down to the specifics, what's the general advice for people living with MS and disease-modifying therapies that our viewers need to know?
So I would say the most important thing is stay on your disease-modifying therapy. That, with regard to protecting your overall health, we know that MS is likely to take off again, so to speak, if disease-modifying therapies are removed. And as I'm going to speak in a moment, most of these appear to be quite safe. The other thing, again, to reiterate, you've got to take extra special precautions. So try to limit your mobility in the community as much as possible, especially if you're in an area where there's a high density of COVID-19. As I said, the good news for us here in New York is that we've seen a dramatic decline and a very low positivity among testing now. But where you are, John, and where many of our listeners may be, in California, in the West, in the South, some areas of the Midwest, sadly, we're seeing that the COVID continues to be very dramatically rising. So in those areas in particular, I would try to limit limit your exposure. Wearing a mask, absolutely critical. I know there's been mixed messaging about masks. Even at the beginning, I was telling my wife, there's no evidence that masks help, but now we've accumulated evidence that wearing a mask has a dramatically beneficial effect in reducing your risks for for COVID-19, and certainly helps to protect your loved ones and the other people that you come in contact with should you happen to be asymptomatically infected. And finally, hand washing. Can't emphasize enough. Wash your hands. Just buy yourself a supply of hand lotion to protect your hands. But every time you go outside, every time you come in contact with objects where the virus might have landed, when you come back in, wash your hands with soap and water, 20 seconds at least. If you're out somewhere you don't have access to soap and water, carry some hand sanitizer, alcohol-based hand sanitizer, and that'll be a reasonable substitute. But soap and water is the best.
Well, each of our viewers who takes a disease-modifying therapy is curious about the advice specific for them and the drug they happen to be taking. So I'd like to review a list of the MS disease-modifying therapies and ask you to talk about any additional specific advice for each. Let's start with the interferons like Avonex, Betaseron, Extavia, Rebif, and the Glitarimer, excuse me, I always trip over that word and I swear I'm not going to, COPAXONE. What is the advice for people taking those disease-modifying therapies?
With the interferons and glitarimer acetate or COPAXONE, these the oldest of our drugs, and these are all, as you know, injectable drugs, sometimes referred to as the platform drugs. These drugs appear where we can say, I think, with quite a good degree of confidence at this point, that these drugs appear to be extremely safe with regard to the severity of COVID-19 should you become infected with the virus. Interferon, the term actually comes about because these proteins have the property of interfering with viral infection. And there is actually some very, I would say, definitely not conclusive evidence at this point, but a suggestion actually that the interferons may actually be associated with a less severe disease. But again, we need much more data still on on interferons, not so much on glitarimer, where we don't anticipate a protective effect, but we're pretty comfortable about the safety of those drugs.
What advice is there for people taking Tecfidera, Aubagio, Gilenya, and Mayzent?
So this is the collection of oral agents, and to this list we might add Vumerity, which is a newer fumarate very closely related to Tecfidera, and the newest drug that's related to Gilenya and Mayzent, which is called Zeposia. I doubt that very many people are on that drug yet. It just came out. But this is interesting because some of the drugs in this class, particularly drugs like Gilenya and Mayzent, we early on were expressing some concern about the potential effects of those drugs because they lowered the lymphocyte count. Lymphocytes are a kind of white blood cell that are involved in the MS process. And the way those drugs work actually is by keeping lymphocytes out of the circulation, trapped in the peripheral lymph nodes. So we had some concerns because of these low lymphocyte counts. But the good news is that so far, with a fairly substantial database now, it's looking as if these drugs don't appear to be associated with an increased risk of more severe disease or death. Again, I want to emphasize always, we still need more data, and it's possible that the information could change still, but it's looking pretty good that these are quite safe drugs.
And what about specific advice for people taking Ocrevus and Rituxan?
So these are drugs known as B-cell depleters. B cells are one form of lymphocyte that are involved in in the MS disease process. And here we do have some concerns. In several of these databases, we're seeing, or several of the registries, we're seeing a greater number of patients on these drugs, or a greater percentage of patients on these drugs who seem to be having severe disease that is requiring hospitalization, intensive care stays, and even death. Of course, we thought at first that maybe this apparent increased risk with these drugs is related to the fact that these drugs tend to sometimes be used in progressive patients or in patients with relapsing forms of MS, but who are doing poorly or breaking through other therapies, so that perhaps the whole population was older or more disabled or had other morbidities that might account for this seemingly increased risk. However, even when you apply proper statistical techniques to factor out those other variables, it still is appearing as if these drugs might be associated with more severe disease. Now, I would say, again, this is not definitive information. This is still preliminary information. It's not worrisome enough, in my view, to say that to a patient who's been on and doing well on ocrelizumab, Ocrevus, or Rituxan should switch their therapy. But it does give us some pause when we're thinking about starting new therapy during this COVID pandemic.
And finally, what advice is available for people taking Tysabri, Lemtrada, and Mavenclad?
So with Lemtrada and Mavenclad, we really have far too limited numbers, and so I would say we just don't know. These are potent agents that also deplete a number of cell types, so they may potentially have a different risk level, but we just don't have enough information. Tysabri is a fairly widely used drug, and its biology is such that we thought initially that it would probably be a safe drug, and indeed there's a good chance that it is a safe drug, but we're getting kind of mixed and inconclusive signals here. So I'd say the best thing we should say about that is we need more data still.
Well, thank you, Dr. Miller, for sharing this very helpful set of insights. Now, I'd like to talk about the latest information about the development of a COVID-19 vaccine. And as you mentioned, since the number of coronavirus cases is rising again, I want to make sure we once again review how people can protect themselves and others. Before we get into that conversation, I want to take a moment, excuse me, to welcome those of you who have continued to join us on GoToWebinar, Facebook Live, YouTube Live. Please let us know what's on your mind. Post your comments and questions on Facebook and YouTube, or type them into the questions box if you joined us on GoToWebinar. Our Ask an MS Expert live event takes place at the same time every Friday, except next Friday when we're going to take a break for the 4th of July weekend. But please help us make sure that everyone knows about it by sharing news about the webinar with your family and your friends. I'm talking with Dr. Aaron Miller, who's been updating us on what we're learning about the impact of COVID-19 on MS. Now I'd like to get into the latest information about the development of a COVID-19 vaccine. And as I just mentioned, with the number of cases and hospitalizations rising at an alarming rate in some states, I want to be sure that we discuss the importance of protecting yourself and others. Dr. Miller, we're going on week 15 since we started updating everyone on the impact of COVID-19 on MS. What progress has been made in developing a vaccine?
So the comments I'm going to make, I want to preface by stating I'm a clinical neurologist. I'm not a virologist and not even an immunologist. So, but I have been following the news very closely on the development of a potential COVID-19 vaccine, and I must say that I'm fairly optimistic. You know, not so optimistic as people who would like to see a vaccine tomorrow or even next month. That's clearly not going to happen. But I do believe that we're going to have a vaccine available far sooner than we've ever had for other infectious diseases. And there's a gigantic effort around the world trying to develop vaccines. You know, I was on a website just last night looking at some of this vaccine development, and it's countless the number of potential vaccines that are going into clinical trials. You know, I think people should understand that ordinarily to develop a vaccine against a particular viral infection takes years. You've got to do preliminary animal studies, then you've got to do very early phase 1 studies in humans to assure the safety of the drug. Then you move into larger studies, phase 2 studies, to start to see if you're getting an effect. And then ultimately, you have to test the vaccine in thousands and thousands of patients, because you have to assure that in the group that doesn't get the tested vaccine, that there are enough cases of whatever disease you're talking about so that you'll be able to see a decline with the vaccine. Now, that whole process is being dramatically telescoped with the development of the COVID-19 vaccine. And even some of these are being studied in the rather unusual format of using human challenge studies. So here, these are studies in which some brave individuals, usually very young, very healthy people, are deliberately infected with COVID-19 in order to see if they've been protected by the vaccine. So we'll all owe them a debt of gratitude if that leads to the rapid development of an effective vaccine. But there not only are there a number of vaccines being tested and developed, but there are multiple different mechanisms of vaccine development. So a lot of different approaches. So one approach uses mRNA, which is a nucleic acid which leads to the translation into one of the coronavirus proteins, not into an infectious agent, but it allows this RNA to be administered as a vaccine that instructs the body to make a protein of the virus. The body then makes antibodies against that protein, which would lead to the protection against subsequent COVID infection. So there are several companies and academic institutions that are pursuing that approach. Another approach uses DNA, you know, the building blocks of life, and also what's involved in the virus itself. And it delivers the DNA to the human by incorporating it into another harmless virus. So we actually deliver a virus that doesn't do any harm. That virus then goes and infects cells, and the genetic material related to the coronavirus gets made in that cell, and then that leads to the immunity. Yet another approach is trying to develop attenuated forms of the SARS-CoV-2 virus itself and administering that, and the immunity to the weakened form but related form of the virus would produce immunity. So there's a lot of different approaches. The other thing that's very exciting is that some of these drugs are already well along in human trials. A couple of them have even begun phase 3 trials, which is the last development, the last stage of testing a vaccine or a drug for licensure. And the US government has invested a lot of money in a program called Warp Speed, in which they've picked several of the more favorable candidates to give billions of dollars to, in the hopes that one of them will strike gold. So that's encouraging. And furthermore, my understanding is that the government on the one hand and some of these companies on the other hand are actually gearing up to make millions and millions, hundreds of millions of doses available very rapidly. So this would be unique for a company to produce a product in large amounts before you even know that the product works. So there's the potential for spending a lot of money on a product that might not work. But on the other hand, we save an immense amount of time and that we would have to spend if we waited to prove that the vaccine worked, and then have companies have to gear up, build plants and facilities to manufacture huge numbers of doses of that vaccine. So I'm encouraged, and I think if you listen to Dr. Fauci, who's a highly reliable and knowledgeable infectious disease person, I think he's particularly encouraged. So I'm hopeful that maybe by early next year, early 2021, we may start to see people getting vaccinated.
When that vaccine is developed and made available, will it be safe for people with MS to get?
I have no reason to believe that it will not be safe for people with MS to get. This is not a live virus vaccine. As you probably know, we counsel people with MS to avoid live virus vaccines because that may trigger MS disease activity. None of these vaccines are going to be live virus vaccines, unless maybe one of those attenuated or weakened virus vaccines hit. But much more likely, they're going to be, so to speak, inert products. So we think they'll be safe. One concern will be, do any of the disease-modifying therapies interfere with the immune response to that vaccine? That is, so that people with MS might respond less well to the vaccine than people who are not taking a disease-modifying therapy. It wouldn't be the MS itself, it would be the potential for certain disease-modifying therapies. And that's data that we're going to have to gather down the road. We just don't know yet.
Well, with the number of cases rising in the United States, you've already touched upon this, but can you please remind everyone about the things that each of us can do to protect ourselves and the people around us from contracting COVID-19?
Yeah, so again, it will be repeating, but it certainly bears repeating. Try to limit your potential exposures by kind of restricting your movements around the community to things that are necessary. Certainly avoid crowds. Social distancing works. Keep 6 feet away from other people. Avoid crowded rooms, especially enclosed spaces. I personally think airplane travel is one of potentially the riskiest things that a person can do during this pandemic. Wear masks, as we've said, at all times when you're in contact with other people, both to protect yourself and to protect other people. And wash your hands all the time when you come in potential contact with surfaces that could affect or be harboring the virus.
You know, we have a question from Luis who asks, what's the risk of exposure by being around one individual that has the virus? So, Dr. Miller, could you put into perspective how quickly the virus can spread by just one individual?
Yeah, so this is a very, very, very extraordinarily contagious virus. So it only takes one person who's shedding the virus and to come into contact with another person, and then that person will rapidly become infected. Will be infected potentially within minutes to hours. The virus then needs to multiply in the body, and that's why you're not going to become sick for a number of days, which is variable. It depends in part on the amount of the inoculum of the virus that you were exposed to, but the virus has to multiply before you're going to get sick. Some people aren't even going to get sick despite the multiplication of the virus, but you don't know. And then there's an exponential spread. So one person is infected, the next person is infected. That person doesn't even know that he or she is infected, spreads the virus to all the potentially many other people that they're in contact with, and we see a very rapid rise. And that's why we've seen these really exponential surges of COVID infections in various parts of the country.
Tammy wrote in saying that they just imposed mandatory wearing of masks at all businesses in her area. And she asks, will this really make a big difference in the infection rate? Maybe you can tell us about the difference wearing a mask can make.
Yeah, I think it's been shown that, wearing, that the use of a mask reduces the risk of exposure by 5 or 6 fold. So you're definitely gaining some protection for yourself, and you're also reducing, in case you happen to be asymptomatically infected, you're avoiding the spread of that virus to other people.
I think that's a really important point. I guess the CDC came out just yesterday and estimated that because of these asymptomatic cases, people who seem and feel perfectly healthy, yet are carrying the virus and can spread it to others, we may actually have 10 times the number of infections than we know about right now.
Exactly. And we know, for example, that children not infrequently get infected, but are usually not symptomatic, and they can bring home the virus to their parents, their grandparents, and other people who will get sick.
Over the last 90 days, I think everyone has started every day saying to themselves that I'm going to work hard to adapt to the new normal. And as soon as they accomplish that, the new normal changes once again. As we continue to say, this is a rapidly evolving situation that we're in. What do you think the future will be like? Maybe you can look into your crystal ball. Do you see any silver linings from all of this?
Yeah, I think a silver lining is we're sharing concerns for other people much more than we may have shown in the past. I saw that in New York, how New Yorkers have banded together really to dramatically drive down the presence of COVID-19 and SARS-CoV-2 infection in our community. So people who work together can accomplish control of this virus. I'm not sure that we can eliminate the virus. I don't really think we're going to be able to eliminate the virus until most of the population is effectively vaccinated. So that depends not only on having an effective vaccine, but getting it delivered to almost everybody. But so that's one silver lining is from the social point of view. I think it's also gotten us to, connect with people that we maybe have seldom connected with over the years, rediscover old friendships and even old relatives. And we know the MS Society has often emphasized the point of how important connections are for the MS community. So I think this is a way through virtual contact, through Zoom or some other platform to connect with other people. I know that's happened in my own household. So I think those are important positives going forward. And I think eventually, probably it will take till we have an effective vaccine to get us back to a more normal. I think we'll learn probably that as long as this virus is still around or subsequent serious viral infections skirt the world, that we know how to take care of ourselves. We know we can lick this. We just have to pay attention to what we need to do.
Well, thank you, Dr. Miller, for sharing your expertise and these very important updates with us. Now, I'd like to focus our time on addressing more of the questions that our audience has for you. Sheila wrote in, what about going to a doctor's office for a long-awaited appointment? With the spike in cases, is this safe?
Yeah, so that's a very important question. And again, it's going to be an individual decision, and it's going to vary from geographical location to geographical location. So for instance, in New York, when we were at the height of our pandemic, well, really, the doctor's offices were shut down except for virtual visits. Our hospital was overrun with COVID patients. You couldn't even go to see a doctor. And so we were advising people at that point who did not have urgent medical matters to put things off for hopefully what wouldn't be more than a month or two, and that's now proving to be the case in New York. And so now, whereas we might have said to a person, well, let's postpone the MRI that you're due for a month or two. But now it's safe. So in an area where the virus exposure is reduced, all of the medical facilities are taking very careful precautions, I know, to protect patients. And I think it's quite safe in those circumstances to go for visits. And it's very important not to neglect your other health issues. The presence of the COVID-19 disease doesn't eliminate your other medical problems, unfortunately. So you do need to follow up. In areas where the virus is surging, yes, maybe you can postpone until things calm down a little bit. And always it's a good idea, if you have any doubt, contact your healthcare provider and get his or her opinion about whether it's urgent that you be seen. I've been doing nothing but telehealth visits for 3 months now, and we can do a great deal in a telehealth visit. And for many patients, it's completely equivalent in utility to a live visit.
Thank you. Christian says, my mother has had primary progressive MS for more than 14 years. And Christian has some questions about new treatments. Dr. Miller, are the recommendations for Ocrevus use during the pandemic different for those with primary progressive MS than they are for those with relapsing remitting MS?
Yeah, Christian, well, I hope your mom is doing well with her disease, but we, in essence, I've alluded to this situation earlier. I would say that most likely your mom should continue on her Ocrevus. The increased risks that are uncertain but may exist with regard to that class of drugs probably are outweighed by her potential need for the medication. On the other hand, again, if one is in an area where the virus is surging, it's probably safe to postpone an infusion for a month or even two with relatively little risk.
Well, I think that may have answered the very next question I was about to share, which comes from Deepa, who wants to know if an MS patient gets infusion therapy every 6 months and wants to delay their next infusion due to COVID-19, how long does the drug last infused stay in the body?
So you have to understand that when you get an infusion of Ocrevus, the drug disappears fairly rapidly. So within a week or two, you don't have the Ocrevus in your body anymore. It's the biological effects of the Ocrevus that is what's useful in controlling the disease. And the reason the drug is given every 6 months is that the biological effect, which in this case is the elimination of B lymphocytes, lasts generally at least 6 months. In many patients, it probably lasts longer. I'm not sure that we have really good data that tells us exactly what percentage of patients lose the effect at 6 months or 7 months or 8 months. There's variability in that. But in general, whenever we make decisions in medicine, we have to balance the likely risk versus the likely benefit, so that, we felt, for instance, in New York at the height of the pandemic, that we could probably safely delay the infusion for a month or two in most patients, and that the risks of it's not its losing its effectiveness in MS were probably outweighed by the gains of not having that patient exposed to the heavily infected community at that time.
Well, Joel has a question. It's also closely related to something we've already discussed, but I think that illustrates how concerned people living with MS are about the effect of their disease-modifying therapy in terms of their risk. Joel wants to know, are people with MS that have a low B cell count and are on the disease-modifying drug Ocrevus more susceptible to contracting COVID-19, or does the Ocrevus only make it somewhat likely that they may do worse if they do contract COVID-19? So does it increase the risk for contracting the virus? And if so, do you have any suggestions to mitigate that risk?
So we don't really think that Ocrevus or rituximab or drugs in that, because we don't really think they increase the likelihood that you're going to get infected. And we don't have any suggestion that that's the case. And B cells are not the frontline defense against viral infections. So their role, if indeed there is a somewhat higher risk for severity of the infection, it probably is related to processes down the road once you become infected. So I don't really think it increases the risk of getting the infection.
Well, thank you. And Julie, if you'd like to pop up, I know you probably have fielded some questions while we've been otherwise occupied chatting here. What questions have you picked up from our viewers?
Yes, this information's been very helpful, Dr. Miller. Lots of questions coming in. Magda is asking a question about a risk factor you mentioned earlier. She said that you mentioned that walking issues put people more at risk, and she wants to know, why is that?
I don't think it's that your problem walking is what makes the risk greater. It's that if you look at the overall population of people with MS who have considerable walking difficulty, those people are more likely to have other comorbidities. So, for example, they're more likely to be overweight, and we know obesity is becoming one of the recognizable risk factors. Lack of ability to exercise may make them more likely to have cardiovascular disease. So I think it's probably the contribution of that more advanced neurological disability to the presence of other comorbidities.
Great. Lori has a question. She would like to know if there's any data about people with MS who have gotten COVID-19 having longer recovery periods, or how might COVID affect their MS?
Yeah, so that's a good question in regard to the recovery periods. I don't really think anybody has been reliably collecting that data. I can tell you, I've been talking to my patients. This is a very limited anecdotal sample, but in the telehealth visits that I've had and with communications from my patients, I've probably encountered about 20 or 21 people who've probably or definitely been infected. And I would say getting a clear answer for them about how long the symptoms have lasted is very difficult. A lot of people have very lingering symptoms. Others are over the whole thing in a week. But I have some people who don't feel completely well for many weeks. With regard to making the MS worse, we don't have yet specific information with regard to coronavirus infection. We know in general that we are always concerned that viral infections in general are a recognizable trigger of MS attacks. And although I haven't seen any data, I wouldn't be surprised if that's the case as well with SARS-CoV-2 infection.
We have a question from Rachel. She has not started a DMT, and she's asking if she should get tested for COVID-19 before she does start. I would say
that in general, one doesn't need to necessarily test every patient who's going to be starting a disease-modifying therapy for active COVID-MS infection, unless they are having any symptoms. And we certainly wouldn't want to start a therapy during the active infected period. On the other hand, if in particular, if one of the B-cell depleting agents is under consideration, then it may be worth knowing one's COVID-MS status. Some people might like to know, have they been infected, and an antibody determination may tell us that. So if for example, a person were uncomfortable beginning a B-cell therapy because there is the suggestion that it's riskier, and they already knew they'd had the COVID-MS infection and they're over it, then that would be a safer consideration. So I think it's an individual issue to be discussed with the doctor.
That ties in, what you were just saying ties into a question Jennifer had, and it's, what about the person who has the antibody? Can they get infected again?
Yeah, so in general, specific, not speaking to coronavirus, but in general, the presence of antibodies is protective. We don't know that yet specifically for this coronavirus. It's probable, but we don't know whether there's a particular level of antibodies that we need. The situation is complicated because there are a lot of places doing antibody testing using different techniques, whether the levels of those antibody responses would be comparable from one methodology to another. There's still a lot of unanswered questions. But at the present time, the expectation is that it's likely that people with at least people with relatively high levels of antibody are going to be protected at least for a period of time, probably many months. And then it's quite likely that immunity will wane over time. And that may similarly happen once we get a vaccine. It's probably not going to offer lifelong protection.
Pamela is asking, with impending school returns, if you are working in a school system and using the DMT Ocrevus, should further protections be taken, like perhaps not returning to work at all?
So these become very complicated questions because, most of us feel we're not in a position to stay at home for the rest of our lives or the rest of the pandemic, because there's no sign that the pandemic is going away in the near future. So people are always going to have to answer this question on an individual basis with regard to what risks they are willing to take, what social value they place in their particular job or in whatever other activities they're going to do. I think the best we can say at the moment in I think it was Pamela's situation is, you have to take every precaution. But many employers are not going to be willing to let a person stay entirely at home indefinitely, especially if the job can't be done adequately from home.
Well, thanks, Julie. Thanks to all of you who submitted your questions, and thank you, Dr. Aaron Miller, for being with us today.
It's been a great pleasure, and I thank the participants for those interesting questions.
I think that one of the best things that anyone can do for themselves, especially during these uncertain times, is to make sure that the information they're getting is credible and reliable. So we'd like to share some resources with you, and these are resources that you can count on to be current and credible. You can always check the Society's website at nationalmssociety.org/COVID-19 for complete updated information on COVID-19 and MS. And you can visit the Centers for Disease Control and Prevention website at cdc.gov for the latest information about COVID-19 from the federal government. And I want to circle back to something that I said earlier. If we were unable to get to your question today, please know that the National MS Society's MS Navigator team is available to answer those questions and connect you with the very best resources. I'll share all the ways that you can contact an MS Navigator in just a moment. I'd also like to acknowledge that we're in the midst of an emotionally difficult time for so many people. And I want to make sure that you're aware of some resources that are available if you find that you may be in emotional crisis. The National Suicide Prevention Lifeline is available 24 hours a day, 7 days a week. They offer free, confidential support for people in distress, as well as suicide prevention and crisis resources for you or your loved ones. And you can reach them by calling 1-800-273-TALK. That's 1-800-273-8255. And I'll remind you that every week on the Real Talk MS podcast, I continue the conversation that we start here. So I hope you can take a few moments and give Real Talk MS a listen. You'll find the Real Talk MS podcast at realtalkms.com, Apple Podcasts, Google Podcasts, Spotify, Pandora, or wherever you find your favorite podcasts. We're all witnessing that even during a pandemic, MS doesn't stop, and neither does the National MS Society. This webinar is just one example of how the MS Society has created virtual programming on the fly so no one has to face MS alone. They've also created virtual support groups. They've provided resources and information about COVID-19 so that people affected by MS can get answers to their questions, and healthcare providers can deliver the very best care to their patients. The Society continues to amplify the voices of the MS movement to influence critical public policy decisions, and they never stop advancing the research that will find a cure. The National MS Society COVID-19 Response Fund has been established to ensure that the Society can meet the urgent and expanding needs of the MS community during these unprecedented times. And I'm asking you, as you're able, to support the MS Society's work by making a donation to the COVID-19 Response Fund. To donate, you can text the word GIVE to 68686, and you'll get a link right to the MS Society's COVID-19 Response Fund webpage, or you can point your browser at the URL on your screen and make your donation. So however you choose to contribute, by texting GIVE to 68686, or by visiting the donation page on the Society's website, please contribute today. It's never been more important. I promised that we'd share all the ways for you to contact an MS Navigator with your questions, and you can find them on the Society's website at nationalmssociety.org. You can contact an MS Navigator by phone at 1-800-344-4867, or you can email your question to an MS Navigator at contactusnmss@nmss.org. You can also connect with the National MS Society on your favorite social media channels, including Facebook, Instagram, Twitter, YouTube, and LinkedIn. And when you do, please make sure to like those social posts and subscribe to those social channels. And you want to make sure that you get on the Society's mailing list by signing up at their website. That way, you'll receive regular updates on upcoming programs and the latest information on MS treatments, research, and how to live the very best life with MS. I'd like to thank Dr. Miller for sharing his insights and expertise with us today. And I'd like to thank everyone who's joined us today for your great questions. Please remember that a recording of this webinar is going to be available for your review on the Society's website at nationalmssociety.org/MSExpert. Now I have a favor to ask each of you. Getting your feedback on today's webinar is important. So you'll see a survey pop up in a moment when we close out the webinar. And if you happen to be watching on Facebook Live, you'll see a link to that survey pinned to the comments section. And on YouTube, you'll find that link in the program description. Completing the survey makes a real difference. The information you provide helps us continuously improve, and it helps shape future webinars. The survey only takes 1 minute, makes a huge difference. So please take a minute to fill it out. On behalf of Dr. Aaron Miller and the National MS Society, I want to thank you once again for joining us. Please stay safe and make healthy choices.